One of the things we hear about all the time in healthcare is how we need to go beyond checkbox compliance, and in particular around patient privacy of data and cybersecurity. That is very true. We've all heard it, right? Instead of just complying, make cybersecurity and privacy a strategic part of your product, of your solution. Well, that's a lot easier said than done. So I wanted to ask a question of an expert in this field of how you can turn something that usually is viewed as a compliance exercise into a strategic one. Joining me on the program today is Patrick Lowe, and he's with Privacy Horizons, and he helps organizations with cybersecurity and privacy challenges. I can't wait for you to hear his take on how important it is to look at this as a strategic part of your enterprise. Let's get to it. Well, Patrick, welcome to the program.
Thank you so much for inviting me. It's a pleasure to talk to you.
Yeah, I'm excited to learn more about what you're doing. But before we get there, Patrick, can you just introduce yourself and tell us a little bit about your role at your company?
Oh, thank you so much. My name is Patrick Lowe. I'm the CEO of Privacy Horizon, an organization that helps healthcare technology companies or healthcare organizations to make sure that they can put in a privacy and cybersecurity control in the organization to build trust with the customer or the patient.
And I think that's so fascinating because you and I were talking off camera about how you really are focused on helping organizations, whether that be provider organizations or companies, tech companies, turn what is seen as a compliance exercise, which is complying with cybersecurity, complying with privacy, into a strategic one.
Right. So, yeah, I mean, we know that depending what role you play in the healthcare systems, right, and your business model, to a large degree, that if you process and have host patient information or health information or personal information or sensitive information, you have to comply with privacy law. And that's given, right? And the question is, how do you go about doing that? Well, compliance means one thing, but how do you operationalize it? A lot of small and medium-sized organizations in healthcare technology space is quite confusing because people still don't know the differences between privacy versus security, right? There are two necessary programs or discipline, if you will, that need to combine together to achieve the whole data protection program. So what we do for small, medium-sized organization to help them build foundation, right? From the compliance perspective, from cybersecurity point of view. And as they grow and they scale up, we help them scale accordingly, right? For more mature organization, then we look at it from maybe assessment from maturity perspective. Are they mature? Are they there yet? Depending on objective, right? And some maturity organization, we provide certification preparation, the SOC 2, Type 2, ISO 27001. So those are the things that we can help depending on where you are, from the organization structure, how mature you are. That's something that we are proud that we can help from a privacy, security, and now talk about AI also, right? So that they can help build trust with their customer, expand the business, and the hospital build trust with the patient.
Well, and I'm glad you went there because that's the end goal of all of this, right? It's not to check the box.
Exactly.
It's actually to build trust with your intended audience, which in most cases is patients and with clinicians as well.
Absolutely.
So why is it so important to think about this not as a checkbox exercise, but more as a strategic infrastructure one?
Yeah, think about it, right? If you look at checkbox, usually it's like yes, no. Do you have policy? Yes or no, right? So a checklist for an organization, right, doesn't translate into something that meaningful, useful, right, from the operation perspective. When I talk about operation, right, simple thing, okay, if you talk about, do you have a privacy training program? If your checkbox say you have a policy, great, but doesn't mean anything. From a compliance or best practice perspective, you need to think about how do you operationalize it. What I mean is, do you have a training material put in place? Do you have a learning management system for employees to take training? And do you know how often do you provide training? And do you know who haven't taken training in your organization? What are the consequences for not taking training? That's the program to operationalize it, right? That's different than a checklist, right? So without that, right, then you are not doing something called information handling best practices, respecting your patient or your customer privacy rights.
Right.
Right? Or the worst thing is you don't even provide a tools to help your employees to understand what they need to do, their obligation from best practice perspective. Right?
Yeah, like I love how you put that there again. Just having that policy in place,
Yeah,
it doesn't protect you. Right?
exactly.
That just is
Absolutely.
the basics.
Yes.
You actually have to operationalize it as you have to provide the training to make sure that the threats don't get past your security firewalls and that someone doesn't click on a link. Just because you have a policy that says you're not supposed to click on a link, this doesn't actually mean anything.
It's great. I mean, you say it perfectly from that perspective. Absolutely.
So give me an example of how maybe you've helped a smaller tech company operationalize their cybersecurity or privacy.
Yeah, a lot of what we do is, most organizations have some sort of control they put in place. But the question is, how robust it is, right? Have they done what they need to do at the minimum, right? So initially, when we start engaging a small startup company, we do some assessment, right? We call it minimum viable pricing program. That's
Okay.
what we have, right? So that we can take assessment to say, look at, what do you have? If you don't have a lot of data, then you may have to comply with specific, I won't say comply, put those control in place to protect those kind of information, right? Out of the outcome of that assessment will help us build a roadmap with you together, say what you need to do to achieve certain level of compliance, control you need to put in place. Be honest about it. Frankly speaking, right? A lot of organizations, when they get started, right, they don't have enough information, enough structure. They don't have to put in a very comprehensive program, which they don't have resources to do it, right? All they need to understand is what are there at minimum supposed to comply. Then we can build on that, have a solid foundation to enable you to have more robust program in the future. Right.
Gotcha. Now, I know we were talking off camera about some pretty big news that's occupying a lot of people's thoughts right now around privacy,
Right.
especially in Canada and cybersecurity. And that is, of course, Bill C-36.
Correct.
Tell me a little bit more about that. What's in it? What should we be worried about? What should we be looking out for?
Well, I mean, we know the federal government tabled the AI strategy, like the AI for all strategy in Canada, right? For quite some time now, a lot of organizations or people in the leadership role think about how do we comply or address AI-related requirements, right? Best practices, right? And the fact that we don't have a national AI regulation or legislation, people just rely on maybe other framework that's out there. To me, this legislation is a way for us to look at a set of rules. How do we work together? How do we address the data issue? How do we can deploy an AI solution that respect individual privacy, right? And also provides a framework for us to have a solution that builds trust with the providers or other customer in the healthcare ecosystem, right? To me, it's exciting the way I look at it, right? The requirements are, to me, when I look at it quickly, it's something that if you're a privacy professional, a lot of organizations already put privacy program in place. I don't think it's going to be very difficult, put it this way, or complex, right? Is to take a look at what you have done now, what you need to enhance or build on, right? Things like that. For those that haven't done anything, it's a perfect time to look at all the requirements, how to go about doing it, right? So to me, it's good news. For us that want to adopt AI, we're going to have a set of rules for us to comply to follow, right? That's something that will be meaningful. I hope that this bill will pass soon, that we can embark on this journey to build trust.
And is there anything specific in C-36 that's specifically around privacy and cybersecurity at all?
Yeah, I mean, safeguard is safeguard. Every legislation talk about safeguard data protection, absolutely, right? The secure control that you already put in place or you should put in place, think about those kind of security standard framework. So aside from there, right, some of the requirements, I think, quote unquote, borrow from GDPR requirements, right? For example, the whole concept right to be forgotten, data portability. Those are the things that is going to be rules that you should companies when they build solutions should factor in, right? And again, we heard about those things from the last number of years. It's not nothing new, right? And from that perspective. And the other thing is, you have to have a privacy management program put in place. Again, if you have a robust privacy program already in place, that should be a non-issue. If you don't have it, that's great. Again, you're going to have a roadmap to help you satisfy those requirements, right?
Yeah, when I look at C36, I look at it as a modernization of Canada's privacy legislation. It's not a
Absolutely.
revamp, it's just
Yeah.
sort of modernizing it.
Yeah.
And also, to your point, if you comply or live up to the concepts that are in C36, you should be able to then go to Europe and other jurisdictions because it borrows so much from those other frameworks. So
Yeah.
what you do here in Canada should allow you to go over there.
Especially for the application developer, right? Sometimes it's very challenging. I understand that, right? That to build different solution, different jurisdiction from control and requirements or compliance perspective, right? Sometimes you look at, if this legislation maybe has a higher standard, then you build towards the higher standard, right? Then which means allow you to build once and use many concept, right?
Yeah.
Things concept, right? So hopefully, I'm hopeful that we'll get something meaningful and useful out of it.
Now, Patrick, you presented a session at the CHIMA event, which preceded this eHealth 26 event. Tell me a little bit more about that particular presentation you gave.
Yeah, thank you for asking that. The topic of that presentation is about trust before intelligence, right? We are talking about how do you deploy an AI solution if I'm thinking about from safety point of view, talk about control, talk about respecting individual privacy right. You just cannot just deploy a solution and hope for the best, right? Without thinking about what should you prepare, put in place before you adopt a solution, right? I mean, we heard about the word governance, right? It's so important, critical, right? Therefore, before you deploy anything like AI, you should think about you should have an AI governance, which means including how do you make decision to deploy an AI? Why do you need to deploy an AI, right? Who should be accountable? What are the risk management framework that you need to put in place, right? What are the policy from an AI perspective you need to develop and adopt, okay? And also think about what problem are you solving? Those are things that the AI governance should be the way the committee itself collectively with different individual sit around the table, make the call, make the decision, rather than rushing into something. And you and I know, no system is perfect. There are many errors, not many errors, there are errors, that happen when you deploy something, right? If you don't have those kind of strategy or governance in place, right? The scary part is when something went wrong, you don't even know, right? And there's no accountability when something goes wrong. You don't know who to look for, like to address the issue, right? That's the scary part, especially in the healthcare setting, right? So that's why I'm trying to remind people. Yes, you can't just hope for the best for something you deploy. Think about strategically and also from a carefully management perspective. Look at AI governance. And if you already have good, solid data governance in place, that's beautiful. You can lay the AI governance on top of that, right? Because when you talk AI, it's about data also, right? So that's the topic of discussion. Hopefully people get some useful, meaningful suggestion or recommendation out of it.
Well, Patrick, you shared a lot of great information with us today. Where can people go to connect with you and learn more about your organization?
Yeah, my company called Privacy Horizon. You can Google us at privacyhorizon.com. And I'm on LinkedIn. You can reach out to me, Patrick Lowe at Privacy Horizon. Yeah, feel free to reach out. Yeah, even just for discussion, share ideas, brainstorming, and I love to talk, engage with people, like-minded set of people about sharing ideas. There's a problem, how do you solve problem, right? If you need help, feel free to reach out to us. We can definitely talk.
Well, Patrick, it's been great having you on the program. Thank you so much for your time.
Appreciate the invite. Thank you so much.
Hey, I want to thank Patrick for joining me on camera. I thought it was just fascinating, all the work that he's doing in the privacy and cybersecurity space. I really appreciate how he is really making things practical in terms of operationalizing both of those things. And I loved his example about, hey, just having a policy in place around cybersecurity doesn't mean you're secure. And just by having that checklist, you could be lulled into a false sense of security. Excuse the pun. Instead, what you need to do is actually think about the training, the LMS, all of the operational ways to enable that policy that you put in place and worked so hard to create in the first place. And hey, if you enjoyed this program, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung here in Halifax, Nova Scotia. Thanks for watching, and I'll catch you on the next video.